You're listening to Vet Synapse, a podcast connecting the world of research, innovation, and practical help to the veterinary profession. I'm your host, Dr. Philip Judge from Vet Education. Let's get connected with Vet Synapse. Welcome everyone to another episode of Vet Synapse with Vet Education. I'm your host, Philip Judge, and I'm joined today by Dr. Melissa Court, the Companion Animal Technical Services Veterinarian at Virbac Animal Health Australia. And we're here to talk about a really important topic, and that is the topic of desexing in companion animals. Now, the background here is that WSAVA released in 2024 for the very first time comprehensive guidelines on reproduction control in companion animals. And it's evidence-based, consensus guided, and it raises some really interesting questions about how we as veterinarians approach our recommendations to our clients around the topic of desexing. Questions that challenge the traditional view of desexing in animals that many of us, myself included, were taught in vet school and that many continue to practice even today. So firstly, I want to welcome to the podcast today Dr. Melissa Court. And secondly, Melissa, give us a bit of a background on this topic and why it's so important.
Thank you. It's a pleasure to be here. I think it's probably a good idea to start with just exactly what WSAVA or WSAVA stands for. It's, of course, the World Small Animal Veterinary Association. It's made up of many groups, or more correctly, committees, comprising specialists, researchers, and clinicians from all around the world. So it's truly a global community of more than 300,000 veterinarians worldwide. And in particular for reproduction control, the WSAVA Reproduction Control Committee not only has specialist representation across the world, but from Australia as well. So that's really exciting to think that Australia is represented on a global platform too. But interestingly, the Reproduction Control Committee was specifically commissioned by the WSAVA to provide veterinarians with the latest resources and knowledge on companion animal reproduction. And it is these resources, most recently the new guidelines, which can then go on to support vets in making, of course, very importantly, evidence-based decisions on managing reproduction in dogs and cats. So for the very first time as a veterinary community, we now have evidence-based guidelines, very exciting, for reproduction control, which also honestly is a relief because the amount of literature in this space, speaking from personal experience, is extensive and quite daunting. It takes a long time to critique what's been published, and it's building that bit of literature too. So, working out whether or not the study was robust with all its elements, etc. So we now have a group that has done all of this to produce the WSAVA reproduction control guidelines. And these were published in JSAP in May last year. And more recently, we had very comprehensive lectures presented by specialists at the AVA in Sydney earlier this year. So now is a really good time to look more closely at what's being called a changing paradigm around desexing. And as far as background goes, in Australia, we only need to go back as far as 2019, when for many of us in the veterinary community, especially those not living in South Australia or Western Australia, where the threat of mandatory desexing was becoming very real, we'd never really had to think, too much about the age at which we recommend desexing to our clients, or indeed whether or not we should be recommending desexing at all. It wasn't necessarily obvious to those of us in general practice, and was really largely unknown that a fair chunk of science had been accumulating for some time around desexing, except for perhaps, the leaving larger breeds for a little longer, which I think is fair to say was well accepted back then. But it was Professor Kutzler, she's from Oregon State University, spoke at the AVA in 2019. It was her lectures that really introduced us to what has been emerging in research around desexing. I remember sitting in those lectures, and she really opened our eyes to just how much research is already out there and just how much recent research is confirming or adding to this picture. A picture, of course, being what happens to individuals after we either desex early or blanket desex at 6 months.
Yeah, that's such an important question for us to consider. And as the veterinary profession has recommended early desexing for decades, tell us a bit more about what happens to our post-desexing patients if they're in that old paradigm.
So we need to kind of go back to first principles, which I have to sort of do a fair bit, particularly in this tech role for sure. But thinking back to endocrinology, when we surgically desex, we're removing the target or distant organ from the whole hypothalamus pituitary gonad cascade. And in removing that target organ, for example, the testicles, we are removing testosterone, which is the source of the negative feedback in the cascade that ultimately tells the pituitary to stop producing LH and FSH. It's a bit like a tap that someone hasn't turned off properly and it continues to drip. And interestingly, it's actually been known, so it's in the literature as well, for some time that luteinizing hormone increases after surgical desexing to what is actually around 30 times the normal physiological level. And the consequence of this, not that we probably ever thought about it, but it was once thought to probably be a passive increase. The consequences now are really coming to the fore with all the research that's been done and accumulating. We're starting to see that evidence building around numbers and sites of LH receptors that pop up in all sorts of tissues when there's an excess of it, and the link between LH excess and the potential for certain cancers, urinary incontinence, or certain musculoskeletal issues like cruciate rupture. So we've got LH receptors overloaded in tissues that shouldn't have an abundance of LH receptors. And if we think about what LH actually does, so of course it's increasing nitric oxide, cell division, blood flow to tissues, then it's not surprising that there may be a link to diseases such as cruciate rupture or anything involving laxity of ligaments or urinary incontinence and certain types of cancer.
Yeah, we're not talking about a small amount either. Like you said, 30 times the amount in the post-desexing period. So this is not like a microphysiological dose. This is a massive increase in the dose of LH. So what are the current recommendations for desexing then?
So let's break down the recommendations of recent times, because it's kind of becoming a hot topic recently over the years, or certainly since 2019 in this country anyway. Actually, probably even a little bit earlier with the mandatory desexing coming into South Australia first and then WA. First, I guess we can have a look at our own AVA sterilisation policy that was ratified in 2020. And this policy document is actually available on the AVA website, but it's also publicly available. So you just Google it, to be honest, to have a look at it. But that also means that anyone can have a look at it. And that includes, of course, our modern pet owner who wants to know everything about desexing and all their options. And actually, that's another interesting factor. We know from research, and I really feel this is the case in clinical practice as well, that, and certainly anyone I've talked to in practice tells me this too, that pet owners today want to be very involved in decision making, not surprisingly, and want to know all their options. So it's also important as clinicians that we are aware of what information is out there. And the AVA policy, having been around since 2022, was a bit of a first, really recommending that we should be looking at each individual and their owner or family. So what is best for that individual dog and our client situation. So as vets, we are used to weighing up, of course, the risks and benefits and having these discussions with owners when it comes to what we recommend for many diseases and treatments. And so now we're being encouraged to do this for the desexing conversation as well, rather than just having and let's book him in at 6 months for routine castration chat at the end of our vaccination consultations or over the phone, when we have owners doing that price ring around that happens from time to time. So the decision to desex, the timing and the methodology to do this should all be individualised, or we're being encouraged to make it so for the pet and the owner. And the AVA policy also lists out all the supporting literature around this decision process, including medical castration and potential health risks associated with surgical desexing. So that was 2022. And then in May last year, the very first WSAVA guidelines for reproductive control in dogs and cats landed in JSAP. Again, that's open access, these guidelines in particular anyway, and then, of course, publicly available via Google. Very comprehensive document looking at all the methodologies when it comes to reproduction control, both surgical and medical. It is a hefty document, having had to go through it myself, 136 pages, but it's very well set out and very easy to navigate. It's a result of 3 years' worth of discussion, analysis and critique by the WSAVA Reproduction Control Committee, all culminating in a wonderfully useful set of guidelines. Now, the committee is a very diverse group of international reproduction specialists, and they were commissioned by the WSAVA to produce the guidelines. And as I flagged earlier, Australia has representation on that committee as well, so that's excellent. And the aim of the committee is not only to present all the evidence as it is now at this present moment for surgical and non-surgical desexing, but to also present it so it could be a useful resource tool. It's definitely succinct, logical, well set out, and enables us to read about the background and where the evidence is coming from, as well as provide the recommendations to I found it very easy to kind of read through, that's for sure. And the group actually has an overarching goal that I've actually sort of written down here, and that is around the well-being of pets, and it's very well reflected in their statement of goals. And I'll just read that out quickly because I think it's quite a nice little statement. It says, the goals of the WSAVA Reproduction Control Committee are to provide veterinarians with science-based information and guidelines to make informed decisions about reproduction control in dogs and cats, while prioritising animal welfare and the human-animal bond. Very importantly, they aim to ensure access to the latest knowledge on this evolving topic and to promote ethical and cost-effective strategies. I think that's a great goal, really. It's all-encompassing, particularly that around the human and animal bond. But importantly, once again, stressing that this info is freely available to us as vets and our clients just by Googling it. And the message that is at the heart of their new recommendations is ensuring that you are giving the client all the options for their pet, not just giving them 6 months regardless, not just getting them back in at 6 months regardless of breed or family circumstances. So that's quite a strong message in those guidelines as well.
Absolutely. Now, I know that you've spoken a little bit about some of the medical things in a little bit of detail, medical issues that potentially could arise from inappropriately early desexing. Behavior is another thing that is focused on around the issue of desexing as well. So that paradigm of altered behaviors, both with and without desexing, is talked about quite a lot. And I'm wondering if you could just tell us a little bit more about behavioral aspects of desexing early versus late and how that pertains to the new recommendations.
Yeah, so I think this brings back to the AVA just this year, because I think the recommendations of the WSAVA Repro guidelines were presented really well from a practical and succinct point of view at the AVA conference this year in Sydney. So that was in May, earlier this year. And there was an AVA lecture from an international veterinary behavioural specialist about the new WSAVA guidelines and the impacts of desexing on behaviour. And unfortunately, his name escapes me, but he called it a paradigm shift away from what was the old paradigm of blanket desexing at 6 months toward new recommendations based on all the evidence we have to date. And he called them the fundamental messages of the new guidelines for reproduction control, and he listed them off, and I've got them here. So firstly, they're very important. He's numbered, there were about 6. So just quickly, the first one was there are very important differences in individual susceptibility to gonadectomy. That I agree is very key from what I've been reading as well. Individual susceptibility, first key point. The second one was that where you were dealing with following characteristics, take care on the recommendations for gonadectomy in cases of large body size, specific breeds, early age, or elements of behaviour related to fear and anxiety. And I think before what we're talking about, that's probably a whole other podcast, to be honest, but the notes for this lecture were very good as well. And then number 3, systematic, as he calls it, desexing is no longer recommended. So that's what I was saying just before about that blanket sort of 6 months, regardless of the breed and the family circumstances. Number 4 was desexing should only be recommended following a thorough clinical assessment. Hopefully that's what we're all doing anyway. It says he's got here, pay attention to each patient and then make a decision. Number 5, so second last, the way the family takes care of their pet should be taken into account. So that's kind of newish, for sure. And then number 6, consider hysterectomy, ovarectomy, partial ovarectomy, vasectomy, and then GnRH implants containing desirelin as an alternative. So if we think about this last point a little more, because of the growing evidence around links to various diseases, when we mess with the negative feedback through surgical desexing, we're being encouraged to either preserve that negative feedback mechanism or to control the LH and the FSH excesses through a GnRH agonist.
Great. Now, Verbeck has got a lot of experience and knowledge in GnRH implants, with Suprelorin being around for, I think, a bit over 20 years now. How does this fit into this new paradigm of thinking based on what you've just been talking about? Sounds like it could well be something that might be able to control some of the LH and FSH excesses that might lead to adverse consequences for our patient. Is that right?
Yes, because it's working higher up. So, as the companion animal tech vet for Verbac, talking about reproduction control guidelines, that is where using medical castration via a GnRH implant comes into the picture. So, Deslorelin is the active. So, Deslorelin is a GnRH agonist. It's actually the first. There's a whole story behind that about it being an Australian innovation and things like that, which is probably a whole other podcast, but very kind of exciting to think it was developed here, but it is the only one that we've got clinically as a veterinary profession. So it is the active in Suprelorin, which is, as I said, the only commercialised GnRH agonist for use in small animals. And it was groundbreaking for its time and developed here, as I said, which was something we're quite proud of. And it has been available for the last 20 or so years. I remember when it was first talked about to me from the company at the time when I was in practice, it was quite an exciting innovation. And it works to induce infertility at a higher level of that cascade that we've been previously talking about. So it works to suppress the production of testosterone in the testicles at the higher level, most importantly. That's why you then get sort of that tap being turned off. So the testes, so working at the pituitary level, the testes then are not producing sperm and infertility ensues for the life of the implant. So the actual GnRH in the implant is just like the natural GnRH, but tweaked in two places to increase its binding affinity to the pituitary receptors. And then being an agonist, it will cause a small initial increase in the production of LH and FSH from the pituitary gland when it binds the receptors before, through exposure to a continuous low dose of the GnRH agonist in Suprelorin, the pituitary receptors are then downregulated. So Suprelorin is an agonist that actually causes downregulation to shut off the production of LH and FSH and hence the production of testosterone. So it's a little bit tricky there. And it's an agonist that actually causes ultimately downregulation and for something to be switched off. So the beauty of this mechanism is that it is dealing with the LH excess that we now know is getting to 30 times the physiological level after surgical castration, because no testicles means no testosterone and no negative feedback to shut off the production of LH and FSH. So close to actually doing nothing, that is leaving the dog intact, which is one of the recommendations of the guidelines. Suprelorin is actually the next best thing for fertility control when that's required, because it's working higher up at the level of the pituitary.
Right. So now let's look at the actual recommendations for reproduction control and the new paradigm for client-owned male dogs.
So going back to the WSAVA guidelines, Repro guidelines, this can all be found on page 116, table 12. Actually, in particular, it breaks down recommendations into those for pet owners that are highly invested in their pets, those owners who are looking to the vet to provide what's best for the health of their pet, and then on the flip side, recommendations for those owners who aren't for one reason or another. For the more invested, responsible pet owner, the discussion is really more around not when, but do I actually need to and why? So no intervention and using a GnRH agonist such as Suprelorin are actually the two recommendations in most cases for this client group. If we compare that to what has been recommended in the Heart papers, there is a trend there for what is now being seen as best practice. So no one size fits all, but rather individual recommendations based on many elements factored in as part of an overall risk-benefit discussion with the owners. And owners not only deserve this type of conversation in consultation, but they are expecting it more and more. So ultimately, the new WSAVA guidelines have prompted discussion, and that can only be a good thing for the ongoing well-being of our family pets and our clients and their pets. We have to consider the breed and the sex of the dog, and we have to consider the owner and the family circumstances. For clients that are regularly coming into the clinic to see us, looking to us, relying on us to keep their pet healthy, we must be giving them all the options for that individual pet. And it may just surprise you how many owners actually prefer medical castration to permanent surgery. We actually did a or was it proper research that was done by an independent body. There was quite a few years ago when we started getting a lot of inquiries about Soprella and people starting to look for other options and things like that. And it was quite surprising, the results of that actually, and how many people sort of wanted all their options and wanted something else rather than surgery and all that kind of thing. So time's definitely changing. I think the way that it's been described as a changing paradigm is probably quite accurate, really.
Great. Well, thank you so much, Melissa, for spending time with us today. And I would encourage anyone who's listening to go to the WSAVA website and download the guidelines. They are very, very user-friendly to read, to find out the section that you're interested in. And like you say, they've done all of the legwork for us in terms of looking at the hundreds and hundreds of articles in a critical manner to make sure that the evidence that is being presented is sound and is backed up by solid evidence and not speculation where that is possible. And also the AVA guidelines as well. It's just absolutely fantastic that we have those available, open access as well for us to look at, and also to help us educate our clients as well, so they can make an informed decision about desexing in their dogs, about the use of use of a drug like Soprella, for example, that might help offset some of the negative effects that might be associated with desexing. So it's a really exciting field of veterinary science that is still evolving, and our knowledge is increasing. So we'll definitely have to keep an eye on this space, and I'd love to chat with you in the future specifically about that AVA sterilization policy and how it aligns with that research, maybe in a little bit more detail. If you're open to coming back and spending another 20 minutes or so with us on Vet Synapse podcast, that would be absolutely wonderful. But thank you so much again, Melissa, for your time today, and thank you everybody for listening to another episode of Vet Synapse, and join our mailing list, and we'll keep you updated with what's next on the podcast. Thank you for listening to this episode of Vet Synapse. If you like this episode, please subscribe to the podcast and share it with your friends and colleagues. Make sure to visit our website at veteducation.com.au for more great content and to experience the latest online race-approved veterinary continuing education.